Zolpidem or Ambien is one of the most commonly prescribed medications to treat insomnia. But is it safe? Keep watching because we're going to go over some of the most common side effects as well as some more rare but concerning ones that you need to be aware of if you're going to be taking this pill. Hi everybody, I'm Dr. Eric Richardson, a board-certified family practice physician. I'd like to welcome you to Family Med, a channel that focuses on giving you practical and accurate medical information to help you and your family. If you think that this would be something that's helpful to you, make sure you subscribe, hit that notification button, and follow along with us. Today, we're going to be talking about one of the most common medications that is given to treat insomnia, called Zolpidem or Ambien. This is a medication that has been available since 1992 in the United States and is the most commonly prescribed sleep medication out there. In fact, over 10 million prescriptions are written each year. Zolpidem is in the category of sleep medications called non-benzodiazepine sedative hypnotics. They work by binding to a certain area in the brain that increases a chemical called GABA, G-A-B-A. When these chemicals go up, it slows the activity of the brain, causing you to sleep. There are several different formulations of Zolpidem. You have regular Zolpidem that tends to last around 6 hours, a more rapid-acting one that lasts up to 4 hours, and a long-acting formula that can last up to 8 hours. They are effective for most people, but you do need to be somewhat careful while taking it, and that's why for the rest of this video, I'm going to go over some important things that you need to be aware of while taking this medication. First of all, this medication is not approved for long-term use. Not that I don't have patients who are not on it long term, it's just that as with any sleep aids, we always prefer to be able to find ways to get to sleep that does not require medication to help us get there. This is a challenge thing for a lot of people, but there are tips and tricks that you can work on to help yourself get to sleep. This is out of the scope of this video, but if you're looking for a direction on things that you can do, start by searching for sleep hygiene online, and it will pull up a lot of things that you can try. The main reason that we want to try and limit the length of time that we use this medication is that it does have some potential for dependence and abuse. It's not nearly the risk that you get from medications like your Xanax or Ativan's, but there is some small risk. And above and beyond that, one of the biggest risks is that you become dependent on medication to fall asleep. So it's always important to try and work on some of the underlying issues that are making it difficult for you to sleep. Now, another reason to try and avoid taking this all the time is that you can develop some tolerance to the medication. This means that you need to take higher and higher doses to have the same effect. Taking a drug holiday where you go without it for several days can help with this. And finally, for those of you who want it for a long time, can be at risk for having some sudden withdrawal symptoms. After stopping it abruptly, you may notice symptoms like feeling shaky, muscle cramps, nausea, vomiting, sweating, flushing, mood swings, and even difficulty sleeping. If you're on it a long time and are wanting to come off, work with your doctor on the best way to do that. Now, the next thing you need to be careful with medication is make sure you're taking it right. When you take this medication, you need to make sure that you dedicate enough time for sleep. Depending on what formulation you have, you need to make sure you have at least 4 to 8 hours before you need to get up. This may be longer in some individuals, so you need to be cautious. The main reason is that this medication can stain your system, and even if you're awake, can affect your ability to concentrate and react. This is really dangerous if you try to drive or do other activities that requires you to be alert. The next thing you need to be careful of is make sure that you don't take it with any other sedative type substances. You shouldn't combine it with alcohol or other sleep aids, anti-anxiety medications like Xanax or Ativan, or even street drugs like marijuana. This is a medication that can work well for most people, but there are certain people who may want to be more careful or avoid taking it altogether. We found that those who have significant mental illness or depression, including a history of suicidal ideation, should maybe try to avoid it. Those who have severe sleep apnea or other breathing problems like asthma, chronic bronchitis, or emphysema may not do as well on it. And it really isn't something you should be taking if you're pregnant, especially in the last trimester, as it can affect your baby. Now let's talk about some of the side effects that are possible while taking this medication. Most people do just fine on it, but there are some things that can happen more commonly. Obviously, this medication can cause some drowsiness. We hope this is the case, but it can extend itself longer in some people. Others may complain of some headaches, some dizziness, and a drug-type feeling. Sometimes we'll see diarrhea, dry mouth, palpitations, and depression. Now, these certainly aren't common side effects, but they are things that you should watch out for. Well, now what about the more concerning effects? Well, probably the most concerning one that occasionally we hear about, even in the news, is some significant problems that it can cause while sleeping. In some people, this medication can cause what we call complex sleep behaviors. In fact, this is a problem that has actually caused them to put what they call a black box warning on this medication. A black box warning is something that the FDA uses to point special attention to a specific serious known side effect or issue with the medication. Zolpidem has one of these warnings. In some people, it has been seen that they can experience certain serious and possibly life-threatening behaviors. There are reports of people while taking this medication getting up and preparing meals, making phone calls, sleepwalking, or even getting out of bed and driving their cars. In the morning, they have no recollection of doing these activities. Obviously, these can be very concerning, and you need to stop the medication right away and call your doctor if you're experiencing anything like this. Now, besides these kind of sleep issues, other more serious reactions can include worsening depression, suicidality, hallucinations, aggressive behavior, amnesia, allergic reactions, as well as dependency and withdrawal after prolonged use. This can be a very effective medication to help you fall asleep, but as you can see, it is not without risks. The risks are still small, so we do prescribe it, but hopefully it emphasizes the importance of trying to avoid using these on a daily basis. They really are meant for more short-term use, and like any sedating medication, needs to be used carefully. Hopefully it also emphasizes the importance of working with your doctor on other options that can help with insomnia besides depending on medication. If you're looking for some better resources to help with your insomnia, I encourage you to go to the National Sleep Foundation website at sleepfoundation.org. They have a lot of great resources on helping you find healthy ways to get a better night's sleep. Well, those are the main points you need to know about Ambien. Certainly there are other things that you may need to be addressed in your situation, so make sure you talk to your doctor about any of your concerns. I'm curious though, for those of you watching, what have been your experiences with Zolpidem? Also, what other tips have you learned to help you get to sleep? If you have any thoughts, we'd love to hear about them in the comments below. Well, I hope you found this information to be helpful. If so, do me a favor. Go ahead and hit that like button and share it with your friends and family. And if your health is really important to you, consider subscribing, hit that notification button so you don't miss out on any of our future content. Well, thank you so much for joining us today here at Family Med. And as always, please remember to take care of your body, because it's the only one you have.